zoom in, Mama. Come this way, Mama. Come this way. Come out there. Alright, guys, we're heading down to the hospital tonight. I have been in some excruciating pain, and normally I tend to just rough it, hold it, but we were advised to go and check it out. So it's like 9:30 at night, and we're heading down to hospital in Montego Bay. Good night. This is just park. Alright, we're here. Is it emergency or main?
No, reception, emergency reception.
Let me try.
I'll check out main reception first. Thank you.
Alright, security just said we go to the emergency section. Yep. I'm getting really bored. Hi. Good night. I want to see you, doctor, for abdominal pain.
Have you been registered here before?
No.
Alright, so on the clipboard is 2 forms that will need to be completed with your information. The clipboard is on.
Oh, here's some.
So, got our patient here in her gown, hospital gown. She's been assessed already by the nurse, so we're waiting for the doctor to come and do some further checks. But hopefully all is well. But they'll figure out the root cause of this continuous pain. What do you think?
They better.
Yeah.
So far, great service.
Great, yeah. Good. A1 service so far. Reception was brilliant. The communication and timing was.
Yeah. Oh, let's check how long did it take us to get through.
Yeah. So we got here.
I got here at 10 past.
Yeah.
10 past 10. And
They were
got
saying
seen.
about
How long have we been in here, so like
Not everything.
5 minutes.
Walk straight to the receptionist when we come. Took all of the details,
Yeah.
filled in the registration forms, and once that was done, we paid, and then within minutes, nurse saw us.
So about 35. Basically less than 35 minutes, and I'm in. I guess you'd consider this triage.
Waiting for the doctor.
So waiting for the doctor.
So yeah, so far, so good. So good so far. So there is good health service in Jamaica. You just have to pay for it. Just like you would overseas for your insurance. You pay and you get A-class service. So yeah.
It's 11:35. No, sorry, 11:25. I've been seen by the doctor. Her shift is actually changing, but she's done all her examinations, and she's gonna hand over to the doctor. She's gonna do her handover with the other doctor, but with everything, she's thinking that she's gonna refer me to have a CAT scan done, and possibly an
examination with a camera.
I've forgotten, I've gone blank. But yeah, so that's the status right now.
Yeah.
So yeah, so the service is, again, we're just making this video to show you guys who, for those who are fearful
Coming back
about
because of
coming
the
back
health
because of
service.
the health service, it's been great class so far. We'll see when we get to the next stage what happens. So yeah, we'll keep you updated.
Yeah.
That's painful. It's still in there. Oh God, it's painful.
You have to keep it.
It's really uncomfortable. I'm not coming in. I look for you like.
Mommy there, string you up for how many bottles of blood did it take?
I didn't look. I never
3
looked.
bottles, I took 3 bottles from you. And this is now an IV drip. And
Should have got the left hand. I forget that they just, when they're doing further tests,
the
left
left
side,
one, yeah. I know you can have to just be ambidextrous.
I hate this. I hate this so much.
Suffer the
Because it's like a plastic, that they have in there, and it's that you can't bend your hand.
I suffer the small inconveniences for the greater good. But yeah, good patient, well done.
So you mix it. A two-part solution.
No, only one is it. Peace and some next one.
I have no hair burn or nothing.
You know, you're on your ass.
No, I'm just a popcorn. I can get they get burned 90. Big thing.
Oh yeah. Rings, matching, slippers, all of these things. Yeah.
This ends. Didn't I just cut this hair?
Which one?
Split down, then I split. Let me just cut the fringe.
Yeah, just got that.
Just cut the piece here. Why? I think she held.
No, she put that hand on it.
Yeah.
Punch it.
No, do the other part.
Yes.
Do it again. Mm-hmm.
Yeah,
That's
yeah.
painful, What's that beeping sound?
Minutes to drink a cup.
Oh, and
Coloring for the scan. So when I scan it, with show it up more.
alright. They just bought me
Coloring.
I have to drink all of it?
No, actually having 1, 2, 3, 4 cups. So let's start one. No, 12:35. The next one at 12:50. 1:05. You do the procedure 1:20. I drink 3 cups. Yeah, 3 cups up here. Well, next one can drink just before you go down there if you want to drink when you go downstairs.
Oh, okay.
Can I drink it one time?
Does it matter if I pee after?
Yeah, no,
Because it's going to send me to the toilet.
No. So once you start drinking, you might want to pee too. So, well, that's not the issue.
Yeah.
And there's a consent form I need to fill out. You just say yes or no. Like so.
Yeah, bring me a clipboard or something.
Yeah. And if you want this to remain here,
So is it syrup?
No, it's something called, they call it contrast. But it has a little syrup in it to give it a little taste. That taste. It's nice.
Okay, it's yucky.
That's it.
But can I have some too?
I guess you have more than 4 cups in there. But I don't.
But I want ice with mine though.
We don't get that because we don't have that. The ice is not. A place where ice is closed.
Okay, I think this is my first time having a CT scan, I think. So yeah, I don't recall ever drinking anything like this.
Yeah. But you know, ma'am, take me that serious. I'm saying what's up.
Can you just talk to the people like full of joke. This is a serious issue, guys.
Yeah, that's it right. Thank you very much.
I forgot the pen.
Because it's a serious issue, you have to make a light of it. You can't take life too serious. Yeah, that's right.
So you guys are always laughing.
Oh, thank you.
Thank you.
Yeah. That's it. You're going to input it in there, right? Any known heart condition?
Nope.
Any known kidney disease?
No.
Are you diabetic or have sickle cell anemia?
No.
Do you have a history of asthma?
No.
Do you have any history of allergies?
No.
Do you have any known history of
Myeloma?
myeloma?
No.
Are you under age of 2 or over the age of are you under the age of 2 or over the age of 65?
No. I mean, wait, that question's a bit tricky.
Are you under 2?
No.
Are you over 65?
Doctor, why are you laughing?
No, that could have made that question simpler. Is there any chance of pregnancy? That's a no.
Is it?
I can know something I mean that now. There's always a chance of pregnancy because you're female, isn't it? But there's not, but you're not.
No, but they're already, put no.
Mm-hmm.
They're already taking the thing.
Are you breastfeeding presently? Yes.
Mm-hmm.
Have you had
Vasectomy?
vasectomy?
Mm-mm.
I have read all the above information and I'm aware of the possibility of having a reaction from the contrast administered.
He never said anything like that.
I have asked any questions that may concern me and I am giving my consent for the injection of intravenous contrast. Okay.
Intravenous? They're gonna put it in my vein?
That's the one they got before.
No, this is that fluid.
Right. Injection. Yeah, so we'll give an injection. Okay.
Yeah, they didn't say we'll question that.
So we can find out about that. Injection. Oh, look at them. Use that.
Off its face. Look at the back. See if there's anything. Contrast for CT abdomen. The patient is to be given 3 cups of contrast while still in ER. Each cup should be given 15 minutes apart. The patient will have the final cup in the CT room. Please send the remaining contrast with the patient. So in the next 2 minutes, I'm going to take the second
next
one.
So are you feeling now? Coming to yeah, no, yeah.
On our way to go get the CT scan.
We wanted to walk or drive?
Drive.
Okay, let's drive.
Can I get this couple?
Okay.
Can I get this couple? You feel?
We're in the Citrix. Yes.
Where's that?
So, unfortunately, we're not gonna get any footage of the actual procedure because I've had to come out the room, obviously. Yeah, so as we've been saying, we've been having some pains for a while now. So we wanna finally get to the bottom of what's going on. So we're doing the scan. Hopefully this will give us the an idea of what's going on so we can get it rectified. So yeah, once she comes out, we'll find out how the experience was. It's her first time having a CAT scan. So the back. How is it?
I was telling him it was like I was in a sci-fi movie that you get injected like in your vein and then you get put through this machine. And I just, yeah. I was like, any minute I'm gonna lose my memory.
What was that scan like?
It was kind of bizarre. The intravenous one that you take, it's like a psh.
Also, they gave you one of that?
Yeah, and this.
Okay.
I didn't expect it to be like that. When he said, "Oh, it's coming now," it might be a bit tingly. It felt like there was a pressure, and then my whole body started feeling, even down to the muscle, start like a burning heat sensation, yeah. And then you go through the machine. It was so weird.
So you put something over there? Oh, you didn't go to your face. That was very quick.
Yeah, I mean, we were in it in 10 minutes. And now so we're back at this medical room. A cube.
Yeah, private room.
Yeah. Why they put that tape?
Secure it.
Let's go from that side.
Next side, left open.
But maybe the oh, you can. Oh,
because remember it's sticking down on this part that's inside, you know?
the direction of the cake and like it works.
At least I get that free wax. It's fast.
No!
Aren't you? There's a little skin on there.
I've never felt it like that before.
Okay.
Yeah.
They were all normal. Your LDH was a little elevated. This is an inflammatory marker, so it's normally elevated if there's any inflammation in the body. So it's just very mildly elevated. Your kidney test and electrolytes were normal. CO2 levels were a little lower, which can happen with sometimes with infection or excessive stress on the body, but again, very minor changes. So I'm not too concerned about it. And then we also had checked your protein and bilirubin levels, which are all fine as well. Okay. This was a CT scan result, just showing again that there's a stone in the left lower quadrant and the distal urethral, and then also showing a cyst on the spleen as well. All right. In terms of the cyst on the spleen, let me see if she did that measurement. About 1.2 centimeters, so very small, and definitely would not be the source of the pain that you're having.
Okay.
So in terms of the pain that you're having, I'm going to ask you a few questions, because from the CT scan, the only thing that would explain that pain would be the stone. Based on how Dr. Sylvester described it, I'm not sure if it was consistent with a stone-like pain, so I'm going to just ask you some questions again. All right. So the pain that you've been having, she said that it was for a few months.
Yeah.
In the lower abdomen.